During ejaculation, nearly 300 million sperms move from the testes through the tubes called the vas deferens into the area of the prostate. At this point, the prostate contracts, closing off the opening between the bladder and the urethra, releasing fluid into the urethra and pushing semen on through. The seminal forms a thick fluid that is alkaline in order to protect sperm from the acidic environment of the female vagina. The gel is liquefied by enzymes from the prostate gland. It also contains sugars to nourish the sperm. The seminal plasma is left in the vagina. When germs like bacteria develop the ability to defeat the drugs designed to kill them, they are not killed and continue to grow. It means we lose the ability to treat infections. By 2050, antibiotic resistance could lead to the death of an extra 10 million people a year worldwide. Some strains of bacteria are resistant to all available antibiotics and are considered untreatable. Antibiotic resistance is one of the biggest threats to global health and can affect anyone of any age in any country. It occurs naturally, but misuse of antibiotics in humans and animals can accelerate the process, and a growing number of infections are becoming harder to treat and leads to longer hospital stays, higher medical costs, and increased mortality. To prevent infection and use antibiotics, always follow your health worker's advice when using antibiotics. Never share or use leftover antibiotics. Regularly washing hands. Avoiding close contact with sick people. Practicing safer sex. And keeping vaccinations up to date. Prepare food hygienically. Keep it clean. Separate raw and cooked. Cook thoroughly. Keep food at safe temperatures. Use safe water and raw materials.
The liver makes a digestive juice called bile and store it in the gallbladder. The stomach produces enzymes and acids, and stomach muscles mix food and liquid with digestive juices. Then, the stomach slowly empties this semi-fluid composition called chyme into the first section of the small intestine, called the duodenum. Your gallbladder squeezes bile through the ducts into your duodenum. Bile helps digest fats and some vitamins. The pancreas makes enzymes that break down carbohydrates, fats, and proteins and delivers them to the duodenum through small tubes called ducts.
Human papillomavirus, or HPV, is one of the most common sexually transmitted infections. Over 100 human papillomaviruses have been identified, and about 40 types can infect your genital area, mouth, and throat. Every sexually active person will likely get HPV at some point in their life. These types of HPV are spread during sexual skin-to-skin contact with someone who has it. The virus can enter the epidermis's basal layer through tiny skin breaks. In most cases, your body's immune system defeats an HPV infection before it creates warts. Once inside, the virus triggers cell growth. This allows the virus to make even more copies of itself. All those extra cells are what cause warts, a potential symptom of HPV. Most people with HPV have no symptoms, but they can still pass the virus to others. Most genital HPV goes away on their own, but in cases where HPV sticks around, it can cause either genital warts or different kinds of cancer. Cervical cancer is most commonly linked to HPV. The cervix is part of the female reproductive system that connects the uterus or womb to the vagina. HPV can also cause cancer in your vulva, vagina, anus, mouth, and throat. Cancers caused by HPV can take years or even decades to develop, so it's always a good idea to get regular checkups. A Pap test, also known as a Pap smear, is a test performed to look for abnormal cell changes within the cervix. Pap test procedure. You should lie on your back on the examination table. A speculum is carefully inserted into your vagina. The speculum slowly spread apart vaginal walls for improved viewing. A cervical brush or cotton is used to scrape some cells from the walls of the cervix gently. You may experience slight discomfort during the collection process. The speculum is then gently removed. The obtained cells are placed in a liquid container and sent for pathological evaluation. You may experience a small amount of vaginal bleeding. It's normal and will stop on its own, and you can return to your routine activity immediately after the test. You should follow your doctor's recommendation for screenings as early diagnosis and treatments. There are several ways that you can lower your chances of getting HPV. Practice safe sex and use proper condoms. HPV vaccine. And make sure to visit the doctor for regular checks. For women between the ages of 21 and 65, getting regular screenings can catch the early stages of cancer and prevent it from developing. The most modern cataract treatment is to remove and replace your clouded lens with a transplant clear implant called an intraocular lens, IOL. It normally takes between 15 to 30 minutes and is pain-free. Your eye will be numbed with local anesthesia in the form of an injection or eye drops. You'll stay awake during the surgery, but won't be able to see what your surgeon is doing. Your surgeon will make a small incision of about 2 millimeters between the cornea and sclera. The surgeon may need to make 2 additional incisions to manipulate with surgical tools. Then the surgeon applies an ophthalmic viscosurgical device, OVD, a jelly-like transparent substance to both create and maintain space in the anterior chamber to protect the internal structure of the eye during surgery. Then the surgeon opens the capsular bag where the lens is located and creates a round opening of approximately 5.5 millimeters. They will then insert an ultrasonic probe into the incision to break up your lens and remove the cataract. The pieces will be removed with the probe using suction. A foldable lens implant will be inserted through the incision and positioned where your original lens was located. Usually with this technique, stitches aren't required. You'll rest in a recovery area for about 30 minutes after your surgery and will then go home. Modern IOL, such as trifocal IOLs, provide great comfort for patients and eliminate vision problems for life. Ingrown toenails are a common condition in which the corner or side of a toenail begins to grow into the soft tissue around it. The result is pain, inflamed skin, swelling, and sometimes an infection. There are many causes for ingrown toenails, but the two most common causes are wearing shoes that constrict the toes and improperly trimmed nails. To help prevent an ingrown toenail, soak your foot in warm, soapy water and try a toe brace or tape. Trim your toenails straight across. Keep toenails at a moderate length. Don't wear shoes that place too much pressure on your toes. If you have diabetes, check your feet daily for signs of ingrown toenails or other foot problems. Surgical removal of an ingrown nail involves removing a small portion of the side of the nail and destroying the nail bed beneath. The toe is injected with numbing medicine, and the toenail is cut to create a new straight nail edge. Antibiotic ointment will be applied to the toe immediately after the procedure. You should continue to apply the antibiotic ointment until the wound is completely healed. You should keep resting for the day after surgery. The next day, you can return to work, but you should refrain from vigorous exercise for 2 weeks after the surgery.
In the brain, alcohol directly affects neurotransmitters, which control behavior and thought. It blocks chemical signals between brain cells, called neurons, leading to the common immediate symptoms of intoxication, including mood changes and impaired ability to think, impulsive behavior, slurred speech, poor memory, slowed reflexes, and coordinate movement. The effects are directly related to the amount of alcohol consumed. However, like many drugs, alcohol also stimulates the release of dopamine in your body, which tricks your body into feeling pleasure, and can in turn make you associate drinking alcohol with feeling great. The tricky part here is that the more you drink alcohol to get that feeling, the less dopamine your body releases. Over time, you end up being mentally hooked, forever in search of that pleasurable feeling you think that alcohol gives you. This is where addictions take hold.
The pH of feces can vary from person to person, and even within the same person over time. While fecal pH is not a definitive diagnostic tool, it can offer some insights into digestive health. A healthy fecal pH typically falls within a range of 6.0 to 7.5. This range reflects a balanced gut microbiome. This is considered ideal for healthy adults. A pH under 6 could indicate a digestive issue, such as food allergy, lactose intolerance, bacterial, viral, or parasitic infection, or an irritable bowel. A vegetarian diet or certain medications can cause the pH of feces to be slightly alkaline, more than 7.
The heart pumps blood throughout your body to give the energy and oxygen to every cell. It's circulation of blood that is vital to sustaining life. As the blood moves, it pushes against the sides of the artery walls. The strength of this pushing is your blood pressure. How can you tell if you have high blood pressure? Having high blood pressure or hypertension is not usually something that you feel or notice. It does not tend to produce obvious signs or symptoms. The only way to know what your blood pressure is to have it measured. Blood pressure is measured in millimeters of mercury and is written as 2 numbers. What do the numbers mean? The first, or top number, is your systolic blood pressure. It is the highest level your blood pressure reaches when your heart beats. The second, or bottom number, is your diastolic blood pressure. It is the lowest level your blood pressure reaches as your heart relaxes between beats. For example, if your reading is 120/80, your blood pressure is 120/80. High blood pressure or hypertension is when your blood pressure is always higher than it should be, and it is usually diagnosed when your levels are always above 140/90 millimeters of mercury. High blood pressure makes the arteries less stretchy and damage the wall of your arteries. This makes it easier for fatty deposits to build up and limits the circulation of blood and oxygen. High blood pressure has no symptoms, and if left untreated, it can lead to heart attack, kidney and blood vessel disease, and stroke. Anyone can have high blood pressure. It can be caused by eating too much salt, drinking too much alcohol, being overweight, or not being active enough. Some effective ways to lower your blood pressure levels. Increase activity and exercise more. Lose weight if you're overweight. Cut back on sugar or refined carbohydrates. Eat more potassium and less sodium. Eat less processed food. Stop smoking. Reduce excess stress. Stay healthy. Dandelion tea.